pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Amy, can you take a roll call, please?
Mr. Gilbert?
Here?
Mr. Detzel?
Here.
Mrs. Detzel? Here. Mr. T-Short?
Here.
Mr. Yoshimura?
Here. Okay, thank you everybody for joining us this evening. Tonight is a special board meeting for a special presentation. And at this point, I'll turn it over to Daryl and Kiva.
So I'll wait till we get the presentation up. Tonight is a presentation for a COVID response plan. So when we talk about our COVID response plan, I want to kind of review some of the things we talked about at our previous board meeting, just to make sure that we can recap where we've been and where we are so people can understand where we're going. Starting in July, guidance has been issued around the pandemic and school response to the pandemic, starting with the American Academy of Pediatrics and the Ohio Department of Health in July. Then in August, the CDC announced guidance. Hamilton County Department of Health announced their school guidance on August 3rd. And then on August 9th, the Ohio Department of Education released their guidance for exposure in K-12 classroom settings. So we've been continuing to get evolving guidance as the process has been unfolding. Just this week, Governor DeWine spoke. Just to summarize a couple of his comments, he reiterated a recommendation to have all school children vaccinated or wear a mask inside of a classroom, but that a mandate would not be coming from the governor's office, and that Ohioans need to make decisions based on data presented. In addition to some of those things that have happened around the pandemic, in the state of Ohio, our legislature has passed recent laws that have put in place different parameters that we have to live within. Governor DeWine signed House Bill 244 that prohibits schools from mandating a vaccine that is not yet fully approved by the FDA, and schools cannot discriminate against vaccinated and unvaccinated individuals by treating them differently. Introduced, but no additional work has been done on this yet, is Senate Bill 209 that would block public schools from requiring masks, but would allow local health departments to issue mandates for schools. In addition to that, House Bill 110 modified some of the schools' ability to respond by limiting the ability to go to a remote format like we did last year when we had to close classrooms, grade levels, or buildings. And it changed the definition of what remote and blended was that have further put constraints around what the district can do in a response. Last time we shared some survey results from our staff and our parents. I've been asked since then to share more information disaggregated about the data. Our staff data is not able to be disaggregated any further than I shared last time, but our parent data is, and this is what I've been asked about most. The question about indicating how much support you have for optional masking for students and staff by level. You can see at the preschool level, the numbers are hard to see, but elementary and preschool, the blue or the yellow is the support for optional masking, which is around 57 to 60%. At our middle school and high school, it is also around 58 to 60% for optional masking. Obviously, that leaves 40% who are either neutral or believe that we should be fully masked. So we have different opinions on what we should do as a school district when we think about our response. On August 9th, our Board of Education came together and they passed a resolution that revised our current policy around masking that took us to optional masking to start the year. At that time, we said we would continue to monitor data and respond as needed. Obviously, we've been asked multiple times about what are you looking at and what are you going to do. Very valid questions that we want to be transparent with our answers to. We have been continuing to monitor evolving data and guidance as it has been coming out. One of the things that we want to be extremely clear on is that as an administrative team and a board, we are prioritizing in-person instruction. We want kids in school. We want school to look like school. We want kids to have normal school activities. We want them to be in groups. We want them to be doing science experiments. We want them to have the best possible school experience that helps prepare them for any possible opportunity that they want when they leave us. Our charge is to do that and honor that opportunity for every kid who comes to our district. That has been a priority that we've heard from our parents as well. Keep our kids in school, and please keep school looking like school. We hear you, and we share your passion for that. The other thing that we know is that our community values transparency, which is why we're here tonight, so that we can be as transparent as we possibly can about our response. We also know that our community values local decision-making, and we value that as well, which is why we've worked really hard to come up with a plan that is tiered in its response and proportionate in its response based on the data we see in our community. So with that said, I want to kind of talk through what our tiered response is. I'm going to start first by talking about the data we're going to track. I'll explain why we're tracking that data, but I want you to realize we are doing it because we prioritize local data and local decision making. We have 6 indicators we are going to track. The first 2 indicators we're tracking are about the 7-day average of new cases of COVID-19 in our community. There are 2 indicators that the Hamilton County Department of Health publicizes. One is the county trend. They publicize the 7-day average. What we have done is looked at our data. We have benchmarked our plan against our data from last year. We looked back into when the surge was happening, and we were seeing it locally in our schools. And the surge was happening in October, but hit us really hard in November. So we are using November data to say that's when we need to start thinking about a tiered response, when our data is looking like it did last November, when we were really starting to feel the impact of that locally in our community. So the 7-day average last November was around 255 new cases per day on a 7-day average. The CDC says that you should be red at 200. We're benchmarking against our local data. Our local data says at 250, we should be concerned, and that's our trend. We also are tracking by zip code. The lowest level of data we can get is zip code data. So we're tracking our 5 zip codes. Granted, zip codes are not enrollment zones. They kind of go beyond just our traditional enrollment, but it's as close as we can get to our local data. So we are tracking our attendance zones as much as possible. We're tracking our zip codes, and we're looking at the number of new cases per day on a 7-day average. Last November, our zip codes had an average of 9 new cases per day. That was the time in the pandemic when it hit us really hard as a school system. And so we are saying that 9 is our number, that when 3 out of 5 of our zip codes are hitting 9 new cases per day, it's a level of concern for us because it's impacting our ability to be transparent about what we want. It's impacting our ability to keep kids in school. All of our plan is about making sure that kids stay in school and staying true to the educational experience that our community wants them to have. So those are our first 2 data points. And I believe that 250 is 255. We updated that with the average. The next thing that we are tracking are student positive cases. On average, last November, when it was hitting us really hard and we were having to close classrooms, grade levels, and buildings, we were seeing on average 14 new cases of student positives. So we're saying that our benchmark for a level of concern is 14 new student cases. Our staff was at an average of 11, so we're going to track our weekly number of positive cases for staff, and when we hit 11, that's a level of concern for us. The other piece is quarantines. I've said that keeping kids in school is one of our biggest priorities, so quarantines are a major concern for us because of the fact that we've been limited in how we can respond based on some guidance from the legislature. We don't have the ability to flip to remote for certain classrooms or certain grade levels. So when kids aren't in school, they're absent. If we have to close a school, it's a calamity day and we're losing instruction. That's not okay for us. We need kids in school. So we're monitoring student quarantines. On average, we were seeing about 65 quarantines from school-based exposure. We are limiting this number to exposures that happen at school, not at home, not at a family function, but in a school-based setting. We have increased that number from the average last year to 75, not 65, because we know we have more kids in school this year than we did last year because of the model we had last year. The last data point we're going to track is the CDC level of community transmission. We are a reflection of the community. And so what happens in the community is in the school as well. So that is our sixth data point. 5 of our 6 data points that we're tracking are local data for us. When we hit those benchmarks, those indicators then turn red. And based on the number of indicators that hit that benchmark, it tiers our response. And our response, I want to preface before I start showing you our response plan, is tiered to make sure that we prioritize instruction first. We want to do whatever we can to keep kids in school, in class, changing classes, going to science and getting instruction from the science teacher, not from a Zoom call, that we keep them in school learning. So just to clarify the difference in a quarantine, students will be isolated when they are positive. When a student or staff member tests positive for COVID, they go under isolation. These are guidelines from the Ohio Department of Health that we have no control over, we must follow. A quarantine is when an individual is considered close contact. That means that they are within 3 feet or 6 feet unmasked. And if they are within those parameters and they are unvaccinated, they are considered a close contact and under quarantine. Again, those are quarantine orders from the Ohio Department of Health, not from the school. We have to follow that. And that means that a student is now outside of school, not learning, and we need to make sure we keep them in at all costs. So when 6 of our data points, if we're at 0 data points turning red, we hit 0 of those benchmarks, or 1 of them, we're going to continue doing what we are already doing. We have already implemented a lot of things to try to keep our kids safe and healthy. We have ventilation systems that have been upgraded with ionization units that purify the air. We have increased the air circulation so that air is being replaced in our school settings at a higher rate. We have cleaning protocols in place. We have hand washing and hygiene that is happening throughout the building. We have recommended masking because that is what the different guidelines have come down as that they recommend masking, so we recommend that as well. Screening stations in our school. We are asking that all of our staff and families do self-screenings before they come to school. So we have a lot of things in place already to try to keep us safe. When we hit 2 indicators that are red on our chart, we're going to begin limiting visitors in the building and at events within the school hours so that we can try to limit the exposure that our kids have and the possibility of being contaminated. So we will limit that unless it's by an appointment. We know there are reasons that parents need to be in a school building, and we are not going to come down with a one-size-fits-all model, which is why we have a tiered response plan, that we're not going to just come out with one-size-fits-all. So we're going to customize this. We're going to limit our visitors. The other thing we're going to do is modify lunch. Lunch is a part of the school day where kids are unmasked no matter what because they're eating. They are in a different environment with different people, and so it is a high exposure area and can create a lot of quarantines, which is what we don't want to have happen. So when we get to a level 2, our buildings will implement modified lunch. I say modified because it's going to look different at different buildings based on the parameters that they have. That could mean that some schools are lunch in the classroom. That could mean that some have restricted or assigned seating so that the students that I sit by in my classroom are the same students I sit by at lunch, because that way, if there's a quarantine, we're quarantining the same groups of students and not increasing the number of students who are now missing instruction. So we're trying to be strategic in terms of the layers of protection that we put in place and layering it in such a way that maintains the integrity of the school environment and keeps school looking like school. If we get to a level 3 and half of our indicators have turned red, that is when we would implement a universal masking for all students and staff. It is a level 3. It takes a while for us to get there, but at that point, we're at such a point that we are losing students to instruction because so many are being quarantined that we need to do something to keep kids in school. The only way to keep school looking like school is for this universal precaution, because ODH guidelines say that if you are masked, you are less likely to be quarantined. And so this will keep our kids in school, which is one of our highest priorities. If we go to a level 4, we're going to mirror some of the restrictions that were there in the spring, limiting indoor and outdoor capacity at events that happen outside of school hours to the capacity limits that were in place in the spring. If we get to 5 indicators being met, we will begin to reduce or limit movement where it creates multiple exposures for kids. Again, the things that are lower on the list are things that start to make school not feel like school, and we want to make that the last possible thing that we can do. This would mean that we might have students who travel in cohorts, not cohorting like we had last year, but traveling together so that they limit the exposure, so that they go from one class to another, and we're not mixing as many kids from one class to another, but trying to limit the number of times they are exposed to a different set of students throughout the school day. So our buildings are beginning to think about what this would look like, because we're trying to do things that create a response, but create a response that increases the ability for us to still have school, but decrease the likelihood that students will be quarantined. If all 6 of our indicators turn red, then we would actually start to implement intermittent active screening of students. That means that throughout the school day, students might be screened for symptoms or temperature, not every kid all day, but intermittent, to make sure that we can try to be proactive in making sure that students who are experiencing symptoms or have a fever, that we can make sure that we remove them from that school environment to limit any of the exposure. So we are following this plan, and this is the plan that we are presenting. The administrators from the buildings have worked with us to make sure that this plan is something that they support, that they believe will be effective in making sure they can operate their schools in a way that still makes it feel like school is school for our students. As we watch this data, when things begin to happen, we will impose the different responses when we see the data there for a week. Once it's there, we want to be clear that it's okay to remove it before we take it away. So when the data drops for 3 weeks straight, we will remove that. Or if a vaccine is readily available for all of our school-age children, once it's readily available and 6 weeks pass to give families time to get the vaccine if they so choose, then the restrictions would be removed. So we're trying to be responsive to multiple things and keep a plan that is agile and allows us to respond, but is transparent for our public so you know what's coming and you can plan for it. We also will continue to respond to any orders that come down. If anything comes down from a governmental agency or health department that we have to follow, irregardless of what the board has passed here tonight, we will be following those orders because we have to. So this plan always has that asterisk that if anything happens outside of our control, we have to follow it. So as we start to think about how we respond, we wanted to be transparent that we are not rushing to masks. It is a tier of response that we can put in place at an appropriate time to make sure school feels like school for our kids. This is where we are right now. When you look at our chart, all 6 indicators, we have one red indicator, which is the CDC level of community transmission, which means right now, nothing is changing. The only other data point that is close, and it's not even close, we have one zip code that is above 9. The other 4 zip codes are around 5 in terms of the number of cases on average on a 7-day trend that are positive cases. So this is where we are as of today, which means we're not changing a thing. But we will continue to monitor data. We will continue to update our public. We will have this on our website so that weekly we can update and share with you where we are, where we're trending, and what is happening, because we believe that transparency is important. We believe our ability to respond needs to be tiered and not a knee-jerk reaction. It needs to be a thoughtful plan that allows for different interventions to be put in place to make sure that we can keep school open, in person, and looking the way we want it to, with instructional integrity to what our teachers are trying to do. So this is the plan that is being proposed tonight for the board. Board members, do you have any questions for me?
So I have a question concerning when you mentioned calamity days and then when students are on quarantine. Just to be clear, it's those days aren't going to look like they did last year with online learning because we don't have that option anymore.
That's correct. The state has taken away our ability to flip to remote, and so when students are quarantined, they will be out sick. We will send work home as we normally do when a child is out sick, but the ability to have that face-to-face instruction with teachers, the ability for us to have that structure in place is not available this year. Plus, our plan is different this year. We're prioritizing in-school instruction, so our teachers have a full teaching load all day long. So it's going to look different when kids are quarantined, which is why we are saying we need a tiered response that allows us to respond in a way to keep as many kids in school as possible.
I just want to say the work that's gone into this, I know you've met with all your AO team, all your building principals, system principals, and the one thing we did hear over and over last spring is the frustration of not getting the kids missed being in school. So the normal school prioritizing that, I think that absolutely has to be our priority. But with that said, I think we also have to make sure we're being safe. And this lays it out, and that as long as weekly updates so that everybody knows where we stand and what's going on, I think this is a very good plan.
And today was the first day with students in our staggered start, and seeing kids at the building, seeing them in classrooms, the smiles, the excitement, the energy, we need to keep kids in person, and we need to keep them in classrooms with our teachers where magic is going to happen, because our staff are amazing, and the way they care for and teach kids is out of this world. And I would put it against any district anywhere. Our staff is amazing. And when we can create an opportunity for them to keep instruction moving, we need to do that.
Well, I think it's also important to remind everyone, masks are mandated on the buses, and that's the Department of Transportation. And so, I mean, the kids are sitting close together, so all children riding buses will be wearing masks to and from school.
I'm glad you brought that. That's that asterisk that says other orders that we have to follow, we will follow. And that is true that the buses right now must follow masking ordinances. And so our bus drivers and our students on our district transportation are masked when they're on the bus.
So last year, Darryl, we had on the website, you could always log into the website and see where things were. Are we going to have something on the website that people can log in and see where these indicators are and where we're at as a district?
We update our COVID tracker weekly. It's been there all last year. That's where we list the number of quarantines by building and the number of positive cases. This chart will be there as well so that people can see exactly where we are and where we're trending and if we're getting close to any of that. And we will publish that every week.
And I just want to thank you for all the work you and your team has put into this. Inevitably, we can't meet everybody's desire and need. This is taking the parents in account. This is all the data that we have, and I think this is about as close as we could possibly get to meet in the middle, if you will, or where people are in school still. And
Thank you. And I do have to give credit to the administrative team. They came together and helped flush this out, helped put the data together, helped organize what was reasonable, because we want to be reasonable with our response. We don't want to just respond in a knee-jerk fashion. We want to be intentional and strategic and preserve the instructional integrity of our programs, and our administrators came together and really helped us work through this in terms of what it would look like, what needs to be where, what responses are most appropriate to keep those goals in mind. Because we've heard from our public from last year, please open school in person, make it look normal, and that's the intent of this plan.
I would just ask that our news media, I noticed, I've looked on several of your websites or things online, that we are saying we're recommending masking, but it is still an option. And I noticed some districts say that, and then others just say optional, but this district is definitely recommending masking, but it ultimately is up to the individual families.
Any other questions I can answer for you?
I just have a comment. I like that this is data-driven with our response and reactionary to our local, what's going on in our local community spread, and data coming from the county and our school district. And, we're not responding to what's going on in, for example, Texas, Florida, and California. We're dealing with what we're dealing with here at Northwest Local School District and being responsive to that.
Yeah, I can't agree more with you, Matt, on that. Just our local information is what's driving this, not what's going on somewhere else in the United States. I think you guys have done a great job getting all this information out to us, and then we can sit here and explain it to everybody. They're going to understand where we're at. You can pull it up on our website weekly and see where we're at, and you can, follow it as easily as we can, the five of us.
I'm glad you mentioned, and I think it's important our parents realize too, that it is not the individual districts, but the legislation has limited all our districts to educate the kids while they're in quarantine. So that's why it is so important that we make school look as much like school as possible, because we're not going to be able to do the Zoom and stuff. So.
Right. With that, we move into the resolution. We have a resolution that amends the mask policy and does make this our policy moving forward. So with that, the superintendent recommends the Board of Education approve the resolution to modify the face covering mask policy for the 2021-2022 school year as listed.
So moved.
Second. There's a motion and a second. Any questions or comments? And that passes 5-0.
Just want to thank Kiva ahead of time for all the time she's going to be putting into this. Our hometown hero was recognized for that, for all the work she did on the COVID response for this past year, and here we go again. So thank you, Kiva, for all your input.
All right. Make a motion to adjourn the meeting.
So moved.
Second.
Motion and a second. It passes 5-0. Thank you, everybody, for attending this evening.